Hello, bonjour, and ahoy. On Thursday evening, GLOBSEC hosted the annual Czech and Slovak Transatlantic Award at the Bratislava Castle and presented the awards to the people of Ukraine and to Brigadier General Karol Rzeka. In parallel, we hosted a networking cruise on the Danube on the GLOBSEC boat. Here's what happened on day 2. We started the day off with a keynote from the Director General of the World Health Organization, who warned about falling victim to complacency in the fight against COVID. Moving to the Indo-Pacific region, India's Minister of External Affairs elaborated on how Europe should look beyond its borders and problems and focus on a more collaborative efforts to solve global problems. Back in Europe, a troika of defense ministers from Slovakia, Bulgaria, and Ukraine shared their views on the current military deliveries to Ukraine and outlined how the country can continue to defend itself in the face of ruthless Russian aggression. In Maria Theresia, icons of democracy from Estonia and Belarus brainstormed on how to counter the threat of autocracy and what ways we can build lasting societal trust in the digital age. Against the backdrop of global geopolitical instability, the ministers of defense from Greece and Sweden, as well as voices from the private sector and the think tank world, discussed Europe's future strategic autonomy. Shifting to the GLOBSEC boat stage, the problematic topic of Splinternet and its ramifications to obstructing interconnectedness was considered. GLOBSEC's Danube Tech Valley initiative was launched, focusing on innovation potential in the region. A multitude of expert voices outlined how transatlantic partners can strengthen its cyber capabilities to counter threats and build cyber resilience. A major debate on the values of the Balkans took place in the Danube space, where voices from the region and Europe speculated on how the European way of life can triumph over anti-democratic forces. In the late afternoon, the Prime Minister of Slovakia and the Chancellor of Austria discussed the pressing issue of food security and solutions to overcome global supply chain issues. We still have so much more dynamic content to bring you from our international speakers and moderators. Don't be a stranger, follow us on social media, and see you on day 3.
Ladies and gentlemen, please welcome the moderator of the session, Prime Minister Carl Bildt.
Thank you, and welcome to this important session on the last day of this important conference. My name is Carl Bildt. I deal with a lot of different issues, but I've also been brought in by the World Health Organization, as a matter of fact, to help coordinate some of the pandemic response, and that, I guess, is the reason why I've also been brought in to share this particular panel. And the topic, we'll come to that, but let me, which is of course coming out of the pandemic, what, if anything, have we learned? And what, if anything, do we need to do better after this? I got a good crowd, and if they could come in, if this works. I introduced them. And now, this will get difficult.
Yanzhong.
Quite. Who is, because of Chinese names is not my specialty, senior fellow at the Council on Foreign Relations in New York, and the CFR has been doing quite a lot of work on global health for quite some time, so we are particularly pleased that you are here on this side of the Atlantic. Please.
Thanks.
Gabriele, no, whatever. Gabriele Grom, who is with Merck, doing public policy there, and Merck is of course making all sorts of stuff that is good for our health.
Yeah.
And then Martin Smatana, who is of course the Economic Growth and Sustainability Program here at GLOBSEC. So please take your assigned seats. And why don't I start with you? And the basic question is, of course, what have we learned from the pandemic? I mean, it's not over. I think that should be stressed. It's still raging in parts of the world, and there are some disturbing trends. We can return to that. But clearly, what have we learned? What do we need to do better globally, European, US, whatever, please?
Well, thank you. I would say Mr. Chairman, or Miss Prime Minister. Well, I think there's a lot for us to learn from the pandemic, right? First of all, right, we know that despite all this, before the outbreak, but despite all these talks about the challenges, the threats of non-communicable diseases, infectious disease continue to be a sustained and significant threat, right? Given this heavy toll that the COVID-19 taking on the human society. Right? And secondly, when we talk about this challenge, I think we tend to think this is a problem confined to the developing world. But it's clear from this pandemic, right, this complacency, a lack of health system capacity building, right, is a problem that is also perplexing the developer world, right? In fact, those countries that were ranked the highest in terms of the Global Health Security Index turn out to be among the worst, right, in dealing with the pandemic. That include, of course, the country, United States. And third, I think when we talk about the origin of the pandemic, right, then even though but you may not like it or not, right, but still I think it's very important if we want to build sound global health security, we need to engage China, right? Which essentially assume a central place in this dynamics among health, development, and security. And finally, I would say in terms of global health governance, right, we need to strengthen the power, the authority of the World Health Organization in terms of relationship with member states, in terms of ability to gather intelligence, in terms of ability to conduct investigation of the origin of the outbreak, and in terms of ability to coordinate international response to the pandemic.
That's quite a lot. And I also forgot to say that, of course, you can raise questions here by asking questions, raise your hand, or you could also use the app, and then I see it here, and I will convey the questions. I should have said that at the beginning. But same question to you. What have we learned? What do we need to do better?
Yeah, I think we have learned a lot about the definition of security so far. Did not always really account for health as well. And I think with the pandemic and the crisis and all the kind of the consequences of the health issue actually, we saw also how important it is to consider health maybe in a much stronger way in the way forward. Looking into what happened with healthcare systems and also how they were put on proof. And we saw very different ways of how healthcare systems reacted to this. And for example, if we look into some healthcare systems and we look in terms of the deaths following per million from COVID related deaths, we saw huge differences, and even across Europe, we talk about 3,000 deaths per million in population in Hungary, for example, versus Finland with only 200 to 300. So we see that there is a very, very vast diversity across the ability of existing healthcare system to deal with crisis, to deal with unforeseen events, and that calls for potentially learning from the systems which were doing better in this environment, to learn from them and potentially also build up the strengths and the robustness all across, especially Europe, which we are focusing on here. Yeah.
Martin?
Well, I completely agree, and I do not want to repeat the idea, so I will just add one more, and it may be a bit unusual, but from my perspective, it is one of the most critical lessons learned, and it is that whether it's us as GLOBSEC, whether it is media, whether it's just random people, we just need to remind politicians and decision makers, the policy makers, that situation has not solved itself and we are likely to face future challenges. That is actually the reason why we yesterday, as a GLOBSEC, presented for the first time something we called GLOBSEC Healthcare Readiness Index, where we, in the first year, this is a pilot year, we looked primarily into CEE countries, but basically we ranked them according to how ready the countries are in facing future challenges that may come. And actually the outcomes were, well, fairly poor, and I'm afraid that considering that well, COVID is not topic and theme anymore. I'm afraid that situation won't get better unless we, as a GLOBSEC, as media, as just people, will just put pressure and remind politicians that things and reforms need to change and be put in practice. So this is the key lesson learned that I've personally taken from the pandemics, and as a GLOBSEC, that is the reason why we've prepared the index. So there is a ranking, there is something easy to understand for people that will remind politicians that situation is not going the right direction, and we need to put more pressure. We need to try harder to make sure that situation will not repeat itself in a couple of years.
No, and we should not forget that the pandemic ain't over. It might look like that in Bratislava, but if we look at the global situation, there are some very disturbing things. I mean, the Chinese are struggling with, to a certain extent, their policy mistakes. I mean, they did fairly well in the beginning, that has to be said, in terms of getting it under control by very severe lockdowns. But then they missed out on vaccination, and they now have the zero COVID policy, which is creating significant economic damage to China and other things. The situation that I think is worth watching, in so far as we can watch it, we really can't, is North Korea, because they have refused to accept vaccines. They have taken some vaccines in order for the leadership to be protected, but essentially have refused any contact with sort of WHO and the international community, which means that you have a more or less completely unvaccinated population, and you have Omicron that is raging there. And even if Omicron has been sort of, we don't see it as particularly deadly because we're all vaccinated. If you are not vaccinated at all, it is as bad as Delta in terms of the effect that that's going to have in the population. So there we might have a hidden huge tragedy that is unfolding at the time. And we also have some disturbing phenomena on the possibility of new variants coming. We don't know that, but we are operating now with different sublineages, they call the BA2, BA4 and BA5 or whatever of Omicron that is creating some difficulties in some countries. So it ain't over before it's over. That has to be said. But as we move forward, clearly, as you said, different countries need to beef up their public health systems. And here there's a significant difference between the European countries, US, and needless to say, the developing world. We need to look at, in my opinion, the agility of the production system, be that vaccines, or be that tests, or be that treatments, because that was somewhat lacking in the beginning. It significantly improved over time. We need to look at scientific cooperation. You mentioned particularly the issue of China, which I think is critical. It turned out to be critical in the beginning of this particular pandemic, but it is, of course, a significant country in terms of also its scientific resources. And the entire handling of the pandemic, in my opinion, turned out to be a triumph of science and an utter failure of politics. And how we carry this forward in a world of increasing geopolitical tensions with both the Chinese and the Russians and others, where we do need, the virus is not part of geopolitics, it doesn't really care, is one of the critical issues. We also have important issues on the global structure. There has now been initiated an international negotiation on, it was called a pandemic treaty in the beginning, updating of the international health regulations. But since the US doesn't like treaties, because the US never ratified treaties, we can't call it a treaty any longer, so it's called something else. But essentially, global negotiations on how we can update the entire framework of rules of governance for the international health system. So quite a problem. How do you see these things from the US perspective, or from your perspective, to be precise?
Well, I'm not speaking on behalf of the United States.
No, but you are sitting in the United States.
Well, yeah, we're facing a very complicated world, and also the very complicated situation, right? Because when we are talking about preparing for the next pandemic, right, we are still in this pandemic. As Dr. Tedros said yesterday, right, it's far too early to say the pandemic is over. Right? In fact, he talks about the emergence of new variants. This transmission represents a real, right, and present danger. Right? And that is further complicated by the problems we are now facing by the war in Ukraine. Right? Although this is not the first time we are seeing war, right, sort of coincides with the pandemic. The last time we had that was 1918, the Spanish flu. And it was also clear, right, that the pandemic did not stop, right, Russia from invading Ukraine. Neither did it, stop either sides of slowing their military operations. That is somewhat different from what we had in 1918, because if you look at history, right, the pandemic 1918 actually significantly slowed down the German offensive. But this is not the time of this time. But not this time. It actually complicated this situation because it sucked the oxygen away from the fight, against this current pandemic, and also the talks about the pandemic treaty. Speaking of the treaty, I think it's to the extent that the 2003 SARS epidemic sort of accelerated the revision of the negotiation of the international health regulation, which is like one of the two international treaties, that negotiated by the WHO, right, to govern infectious diseases. But this time you would hope, right, that the pandemic would accelerate the negotiation of the pandemic treaty. But this is you see the thrust of the government to basically devoted, right, by the war, because now the human toll, right, caused by the pandemic now needs to be balanced against the geopolitical objectives of the war in Ukraine. So you saw this, this divert not just the attention and the commitment, right, to fighting the pandemic, but also, right, that this caused the financing issues, right? The financial, we are already seeing that, right, happening internationally. And not to mention that the pandemic treaty itself, when we talk about, don't put high expectations on it. In my opinion, as long as that the structural relationship between the WHO and its member states remain unchanged, don't expect any profound change in the international governance capacity in handling this pandemic and the next one.
Don't expect any radical changes. Would you agree with that?
Yeah, so I would say we have had already a lot of learning and a lot of changes under the pandemic. And I'm looking into this now with maybe a little bit more from a European point of view. And I have seen that first in time things were happening under the pandemic. So there was an absolute need to act very fast. And so what was happening is, of course, one thing was the development, the speed of development of vaccines against COVID. So that was unheard of. Then the next event was that the European Union came together in a very united way to look into what can be together, for example, in terms of like purchasing these vaccines. Never happened before, together to have really a plan for all the countries and to do some initiatives together. So I think that is also something which we had never had before. And now, of course, there is a lot of discussions on what is now the next steps and how can we even work closer in terms of bringing things more together across country within Europe. So also one example is, and maybe COVID and the pandemic was also a catalyst to look into the European health data space. To really see what is the value of data across the different countries. And of course, we needed to have that, to have the vaccination certificates being valid not only in one country, but also that you could continue to travel across the European Union at least. So these are the things which were happening for the first time and which are, so to say, like accomplishments of the pandemic and of the necessity there. So let's see, and I hope that it will continue to bring countries, stakeholders, different partners together much closer for the benefit of learning from all of these things, and of course also not only to have a vaccination record on a global, on a European basis for COVID, but now in the future share much more health data and really work and act together in a new way. So I'm very hopeful, and I want to see not only the negative things, but also the positive learnings bringing us forward in the future for either a new kind of challenges which we have, or also for just improving health outcomes overall.
Martin?
I completely agree with the data bit. It is true that EU Commission acted, and there is new direction coming that should really govern the way how secondary use of data should be spread and applied in practice, which could save tens of thousands of avoidable mortalities per year. And it is one of the consequences of the pandemics. There aren't very few which would be positive. This is probably one of that. But from my perspective, even this is very good step. I'm not that optimistic because from my perspective, for example, when you're talking about the EU Commission needs to step up in more aggressive manner and way because when you look into which country in the EU did the best job in management of the pandemic, you will, for example, find, for example, Norway, which is the country which has over the years have invested heavily into other infrastructure, but basically into public measures. They implemented a variety of measures how to reduce bad habits of people, smoking cessation, alcohol consumption, and they really developed a concept where people, inhabitants, believe that they should care about their own health. And this is one of the biggest issues that we have in Europe and actually worldwide, is that we got used to the fact that we believe that we are entitled to everything, but are not obliged to do anything. So the pirates used to say, take everything and give nothing back. And this is something that causes people not to behave in the way that they would actually prevent diseases to happen, because they just act selfish, which causes then a consequence of having diseases and then a consequence of governments having to pay for that. And unless this is changed, which cannot be changed on, let's say, on the basis of that a country decides to, it needs to be a global approach, a global initiative that will force governments to do it. I'm afraid that the changes that we need to make in order to prepare ourselves for the future won't be sufficient. And the biggest problem is that governments in most cases are not interested in public health measures because they take years to materialize. It takes years to reap benefits. It takes years to decrease cost or incidence of non-communicable diseases. And in most cases, they budget and they plan just for 3 to 4 year period. And this can be changed if EU Commission stepped up and developed policies which would be which would have to be applied and implemented in every single country. Yes, this would require EU Commission to have much stronger competencies, which is something that back in my days, I was responsible on behalf of Slovak healthcare for EU semester country-specific recommendations, and I did my best to make sure the EU Commission does not expand its competencies. Right. But now we see that if EU Commission had greater competencies during COVID, we could have saved thousands of lives, because many countries were struggling not because of resources, but because of the policies that they're making, because of the processes, because of the lack of data. And from this perspective, I really believe that EU Commission or WHO really need to have a stronger position when it comes to healthcare of member states.
I mean, that sounds good in theory, but as you alluded to yourself, health policy is domestic policy. It's very sensitive policy in different countries. So it's sort of giving power over national health system to the Commission in Brussels is not going to be an entirely easy sell. In the US, you can see how sort of national health policy is sort of, apart from immigration policy, I guess, one of the more poisonous aspects of US domestic affairs. So these are tricky issues. Let me, from my perspective, add two sort of things just to point out. First, I think it's important to bring to policymakers the recognition that this will happen again. SARS was 20 years ago. We learned a lot from that, but evidently not enough. And we've had MERS, and we had a couple of wake-up calls, and we didn't wake up. And then we got this particular one. There is no reason whatsoever to assume that this was the last one. So we're going to get another pandemic, a coronavirus of some sort. It might come anywhere, anytime. It might be more contagious, less contagious, more deadly, less deadly. We don't know. So preparedness needs clearly to be there. Then another lesson that I think is important is you mentioned the response of the Commission and the EU, which sort of improved over time. But we should not forget that it was a bloody mess in the beginning. Due to the fact that there was sort of border restrictions going on. I remember we had a company in Sweden doing ventilators, trying to deliver those to Italy, and they were confiscated by the French because the French said, well, we need them or whatever. We had the breakdown of the internal market in Europe in the beginning. Then the Commission managed to get things going. That was good, with the public sort of joint procurement as well. We had a breakdown also of the global value chains. Defense Procurement Act was used in the US to control things. That had a significant delaying effect on global production. We had in the beginning roughly 150 different trade restrictions on the different components of what you need in order to make vaccines. That significantly slowed down vaccine production. That is now down to, I think, between 30 and 40 remaining. EU had export controls for a while and was sort of having a battle with the UK, which is fundamentally destructive for both. We have the Indians, for reasons I can understand, and they were the biggest vaccine producer in the world prior to that. They will suddenly have export controls of it because they had their outburst. But we have learned that functioning global value chains are extremely important in order to get things moving, the production chains. And that's not easy message for politicians to take on, because in any crisis situation, it's so easy to wave the flag and say, I'm going to control everything. But if everyone stands there and say, I'm going to control everything, the thing breaks down and collapses fairly fast. Whether that lesson will be learned remains to be seen. I have a couple of questions coming in. Some anonymous and some. One, how do you, from your respective roles, perceive the lack of qualified health personnel? And what can we do about that? What can be done to mitigate those risks? You can see the questions up there. If you take that one, and I would also, another one, how would you make more harmonized and transparent procurement of vaccines for EU region or worldwide for equal distribution of vaccines in the future in case of emerging need? That's a more complicated way of saying, did we really do right in the rich world to buy all the vaccines and deprive the poor countries of it in the beginning? Because it's a huge equity issue. It's a huge issue there in large part of the world who says, you, the rich ones, you bought everything, and we were left with what was left over. But start with those two issues, the equity issues and the availability of qualified health personnel.
Well, I pick the equality issues, right? Yeah. The vaccine access, right? We know that is, in order to bring a speedy end of the pandemic, we need to have, right, at least more than 70% of the population, right, being vaccinated, being fully vaccinated as soon as possible, right? But so far we haven't achieved that, even that goal, right? Is, I believe only 60% worldwide has been fully vaccinated. We do have, right, this mechanism that is COVAX, right, that try to, right, address this problem of the global, right, the equal access to the vaccines. But the thing is that it only cover, right, a relatively small percentage of the population. Right? In fact, this is the lesson we have to learn from that. This is how this pandemic response now being framed, as the ideological competition, right, between two countries, and also becomes sort of like used to pursue geopolitical objectives. So you have, for example, China being in the initial stage of the pandemic, right, the largest exporter of the vaccines, but this is used to practice vaccine diplomacy, right, to achieve geopolitical goals, to project the soft power, right? And then United States, right, when they try, well, they make all this vaccine, the donations, right, to the COVAX and also through bilateral means, right, donate to other countries. It'll try to also use that to achieve geopolitical goals, right, to basically counter China's influence. I think this is unfortunate because it causes even more inequalities in the global access to the vaccines. Because whether this country, right, especially a developed country, you can receive the vaccines depends on how strategically important you are, right? Not how urgent, right, or from a public health perspective, in terms of whether that's necessary or not.
So I would like to pick the other question on the healthcare workers. I think the pandemic has shown us that how critical it is to also look in different areas in the healthcare systems. And I consider health personnel as one of the very, very critical pillars in really driving effective and efficient healthcare systems. And of course, we need potentially to also look here into what needs to be done and really learn from the pandemic. I think it potentially comes together with the priority which we give into health in general and the importance of healthcare. And with this, it comes, of course, also the healthcare workers. So it's on one hand, it's capacity questions. And the other thing is, of course, also everything what comes with salaries and the discussion on whether we have enough people which are taking care of sick people in hospitals. How do we fund? How do we educate? Also, how do we position it in the society? We had so many kind of celebrations of healthcare, of nurses and physicians during the pandemic. And there were so many promises made, and we felt so thankful for all the work which had been done. But finally, what happened? Nothing really happened in order to look into salaries or increase the kind of the compensation and so on. So I think we need to now also walk the talk and look into what is needed to create more resilient and more robust healthcare system. And it comes clearly as well with the workforce.
Good question that needs to be looked into. What has been done in order to improve the recruitment and the remuneration of all of the staff that we in the middle of the pandemic were so extremely grateful to and extremely dependent upon. But have they been suddenly forgotten again, Martin?
Yes, and once again, I completely agree, and I actually think that HR is going to be reason why, after some time, the gap between Eastern and Western Europe is actually going to be even bigger, for actually two reasons. First reason is that if you look into, or if you compare a number of nurses and doctors per capita, per 1,000 inhabitants of countries, you will see it is actually Eastern Europe, which is by far the worst, or they have the worst ratios already. And secondly, if you look into strategic documents, papers, or even some reforms that some countries in the western part of Europe and world have already taken, for example, UK published in March a document which is called Build Back Better Health and Social Services. They actually claim that, yes, they want to expand on investments into healthcare, they want to raise budgets, but, for example, in the UK, they claim that their strategy of how to reduce the backlog of care that could not have been provided because of the pandemic, they claim that they want to employ 50,000 nurses. And where you can find 50,000 nurses, usually you go to the eastern part of Europe and, well, the continent, because it's cheaper there. And so I'm really afraid that unless steps are taken and unless somebody, well, will try to help CE countries, in coming years, we are going to face greater shortages than today, and I'm afraid that the gap will deteriorate in coming years, unfortunately. But there are some solutions which can be implemented, but unfortunately, I'm afraid for most of CE countries, it's too late because the shortage of personnel is already way too high, unfortunately.
Back to we don't have any questions in the audience that I see. Back to the digital questions. I have from Luis van Schaik here. In the past, the global health security agenda aimed to boost how do we renew the human capital in healthcare. That was driven to a large extent by the US Obama administration, if I remember it, in those days. The shortage, no, it's up there. So is it still alive, the global health security agenda? Should it be reactivated, or are such parallel tracks undermining the WHO and the more sort of comprehensive multilateral efforts?
Okay. Well, I would say that the global health security agenda is not dead. It maybe just needs some life support. The problem here is that the agenda certainly has not been able to prevent, right, the emergence of a dangerous pathogen, that spread across the world and take a heavy toll, right, on the economy, the society, right, and international relations. But I think in the post-COVID world, this agenda, I think, should not be trashed. They should be, I agree, reactivated and strengthened, right, to boost global health security. Especially because here this is, ideologically divided world. Right, this is one of the mechanisms, that can reach out to countries, no matter they are autocracies or democracies, right, in handling a common threat. So I think it makes sense for it to be strengthened, not to be undermined.
But it was, if I remember it was launched very much. It was very much the Obama administration, at least I associated with it. It was largely sort of the Ebola response that sort of crystallized global efforts. Then, of course, came another administration in the US, if I remember things rightly, and the entire thing, in terms of US leadership, collapsed or disappeared completely. US left the WHO even, and then the global health diplomacy, if we call it like that, since then have been concentrated on fighting this particular pandemic and mobilizing the resources and getting vaccine production and all of that. So it might be that this is the time to revitalize the global health security agenda and looking somewhat forward, and doing that then in parallel with the negotiations on the pandemic treaty and other things. I don't know if you have anything to add to the global debate on these issues.
Well, I would have to probably think, because this is not the topic that I would be expert at. So maybe if you have some words on it.
Yeah, I think it's, I can't add a lot of detail on this, but I think also here it applies. We are talking about the global world, and we have seen that we have global issues in terms of a pandemic to manage. So it can be only solved on a global level and with collaboration and partnership across the world.
And then we have a couple of more political questions. Is China's zero COVID policy sustainable?
Well, that is easy. The answer is simple. No, it's neither epidemiologically or economically unsustainable. Right? Actually, WHO agrees. Right, that a couple of times says this is not sustainable. Right? From a public health perspective, right, A, it cannot eradicate the virus, and B, by shielding the population from the virus, is actually sustain the immunity gap between China and the rest of the world, right? So you can bring a situation under control in a short period of time, by rely on those heavy-handed measures like lockdown, but it's just a matter of time for you to expect another one coming. Right? And and economically, this is actually the cost, way too high. Well, this is, we talk about disruption of the supply chain. We talk about the weakened macro expectations. We talk about suppressed domestic demand. You know, this is not just going to threaten China's ability to achieve its 5.5% economic growth objective this year, but it's having its impact now being felt, soon to be felt worldwide because its impact on the global supply chain, the increase, the inflation pressures, and potentially in combination with the war in Ukraine, contribute to a global recession. So that is why, earlier this year, the Eurasia Group report and make the China zero COVID the number one risk factor, right, for the global health security.
I saw the figure for the shipments out of Shanghai port, which is the biggest port in the world. It was down year by 53%. That's quite substantial, to put it very mildly. And it shows the impact of sort of how important health policy is, how we manage it. If you take 2 years ago, at this particular period in time, China was on its way out of the pandemic, and the Western world was on its way stumbling into the pandemic, because it was not a very sort of gratifying scene at that particular time, while the Chinese were getting it under control. Now, for a number of reasons, it's the other way around. Most of the Western world believe that it's on its way out of it, and I hope that's correct, while China is struggling. And the developing world is also to some extent struggling, although immunity is starting to set in large sectors of the population. So pandemic policy or health policy is turned into highly significant for economic development, for political development, and for quite a number of things as well. Should we take one? We have a couple of minutes left, and could I get the questions up there so we can see them? Yeah, slide the questions up. Take them all up there so we can see them. And I suggest that you pick one of questions each there, out of which one, and give an extremely detailed and comprehensive answer to them.
I would like to take the utilize evidence for development of evidence-informed policies. So I think there is so many data which we have in our healthcare system today, which are in some buckets and they lay around, but they are not accessible. So if we would leverage on all what we have and even increase the interoperability of data collection, it would create a kind of an opportunity to learn from the data and to create insights when it comes to healthcare systems, healthcare infrastructure, and address health inefficiencies. At the same time, also know much more about health outcomes, and with this, of course, being much better equipped through data-driven decision-making, to create better health and better outcomes. And I think that's an enormous potential which we have, which is currently untapped. And I think we all need to become aware that this is really very, very powerful for the future. For better outcomes for patients, for systems, for even economies, because health is wealth. So the better we are able to manage health, the better also our societies and our economies will be doing. So I think that's something which can really act as a catalyzer into the quality of healthcare.
Martin, your choice of question?
Okay, so I'll just continue with the assuming we will have the right science to combat future pandemic. How do we renew human capital in healthcare? Well, the point is we already have all tools we need to combat future pandemic, because the future pandemic will be pandemic of obesity, of diabetes, of non-communicable diseases. But the malicious thing about these factors is that they don't happen instantly, because if you the the COVID was unique, that you get infected and you would get sick within a couple of days. When it comes to obesity, it may take years to materialize. So we already know what's going to happen, but we just don't act because it doesn't burn. It's not a problem today. And yes, there are some tools and policies which could be implemented. And one of the reasons why there is a shortage of nurses and doctors in, for example, Europe, is that the HR planning is done on the basis of each member state. So every single member state does the planning for itself. But the problem is that some countries, usually the ones which are more developed, have greater demands on HR because they want to provide patients more comfort or better type of care. And therefore, if you add it all up, it doesn't sum up to zero, which means that some countries request 50,000 as the UK, some countries request 5, some maybe have enough. And that's why when long or medium to long-term planning of HR capacities is done, it just does not add up. So what we need a centralized EU-level HR planning processes, so this doesn't happen as it is done today. And if this is not the case, we will be forever in the vicious cycle that one country will demand more, the other has no idea that there is such a request, and we will be in circles forever. Yep. And this is one solution that could be implemented, is not that difficult, and well, is implementable within actually a couple of months to years.
30 seconds.
Okay, I'll quickly talk about the WHO, right? This is the very crowded governance space, but WHO's role is not replaceable. You know, that I think it's time for us to strengthen the organization, not to undermine it. We need to strengthen its funding capacity to increase the proportion of assessed funding. And in the meantime, we need to strengthen its role in global health governance, so that it has the independent capacity to gather health-related intelligence, to be able to be dispatched to the countries where that suspected that the outbreak is happening. And in the meantime, I think this last point is we need to strengthen its accountability mechanisms for WHO. Right? If it made a mistake, right, someone has to be held accountable for that.
And that's a good final words. We need to strengthen the global health architecture in different ways. We need to beef up national systems. We need to be aware of the fact that the pandemic that we've just, to some extent, come through, with all of the devastating human, economic and political effects, it wasn't the last one. We need to be better prepared for the next one. Thanks very much. And could I just remind you that the next session, which is going digital, which is the goals of the Czech presidency starting on the 1st of July, starts immediately after this. So you are not allowed to stand up even. You are, you are committed to stay for that particular session. Thank you very much.
Thank you.
Ladies and gentlemen, please welcome the moderator of the session, Ben Mueller.
Good morning, ladies and gentlemen. Thank you very much for joining us on this last day of what's been a fantastic GLOBSEC 2022. We are going to be exploring the goals of the Czech presidency of the European Union, which is shortly due to begin. My name is Ben Mueller, and I'm a senior policy analyst at the Center for Data Innovation, which is a think tank that explores the role of technology and digital technology in promoting economic growth and innovation. And I'm very pleased to have with me today discussing this topic Ivan Bartoš, the Deputy Prime Minister for Digitization and Minister for Regional Development of the Czech Republic, and also all the way from Ukraine, he's traveled to be with us today, Slava Banik, who's the Head of Digital Service Development at the Ministry of Digital Transformation in Ukraine. Please join me in thanking our panelists for being with us today.
So
Thank you.
Sit there. Okay.
I would like to remind the audience, both in the room and online, that you are able to ask questions today. This is a moderated Q&A. I'm going to kick things off by directing some questions at our panelists, but please use the Slido functionality on the GLOBSEC app, or if you're a traditionalist, just raise your hand and I'll try to get to as many of you as I can. All right, well, let's kick things off and dive straight into the topic of this session, which is the upcoming EU presidency of the Czech Republic. Minister Bartoš, you've just returned from Luxembourg, meeting of the Telecommunications Council, which I understand was also the sort of handover from the French presidency to the Czechs. Could you give us an overview of the Czech government's priorities in the next 6 months of the main digital files that are currently under discussion in the European Union as part of its digital decade strategy?
So thank you for inviting me here. We just arrived yesterday from Luxembourg, and we were missing a few important people because they were here on the GLOBSEC before. But I think that the distribution of people who knows and they who show the path of the European countries for the future, it's important. So you touch all the different topics such as security but the future of the digitalization of Europe. Above all of everything, I have to admit that the Russian war on Ukraine, right, affects the priority of individual states of Europe and of European Union as well. But there were a lot of said about that, right? So I would really answer the specific question, which is a long-term strategies and the files that would affect the evolution of a digitalization for individual countries and Europe itself. And it's obvious that the French governance or French presidency finished some important things. DSA, DMA is in place, right? And there are important files that are in front of us. I would name 2 of our priorities in that field that are very specific. And first of all, it's Artificial Intelligence Act. And I'm really happy about that because in many areas and agendas, we were trying to put a regulatory framework over something that already developed and existed, right? Because the internet's got no limits, and the business and the governments actually somehow operates on the internet. So artificial intelligence, we want to get the general approach on that, put the smart regulatory framework, which on one hand, would protect the privacy and the misuse of a technology that's on the rise. But on the other hand, would be, let's say, gentle or in favor of innovations, especially for the small businesses at the SMEs, innovation hubs. So we won't kill the progress, just over-regulate the entire market. And I'm pretty happy there will be those regulatory sandboxes when you can actually test your implementation and application. Either you fit in the, let's say, safe usage, or you just go to some place where you don't want to be, which leads to mass surveillance, and really misuse of the technology, how we can see in other states. Another important priority, and we've got the same goal with that, and it's also priority of a Czech Prime Minister Petr Fiala, it's e-wallet and e-ID, the tool technology that would be used in entire Europe based on individual state technologies of what you develop. And we learned a lot through the COVID, right? So the first pilot project was actually a COVID certificate that worked in entire Europe. It's much harder to have, like, let's say, safe and secure ID that you can use to enroll in university, purchase property, do business over the internet, book in the hotel. So there are many variations and opportunities of individual applications on everyday human's life and its needs. And we got to work on that. So I'm pretty sure, and I'd be happy if we achieve that agreement between 27 and that technology would be useful for the citizens. And there is a big one also, it's a Data Act. I don't know how far we can get with this process. It's about the data stored in Europe, data that's passed over the sea. So there is an important role of our transatlantic connection. And the discussion is taking part in TTC. So I'm looking forward what outcome of the TTC would be, because now we are guessing. So I hope the Commission would get more open and inform us on the intermediate results, because everybody is expecting what would be the outcome. Not only the governments of individual states, but also our business partners. And believe it or not, we have to work on digital transformation together. Governments, NGOs, academics, and businesses, especially in security, when those are far in front of, above what the government can achieve by itself.
Thank you for that. Very interesting. Clearly, a rather crammed in-tray for you, and lots of work coming up. You touched on the fact that we've got an ambitious regulatory agenda in the European Union when it comes to digital technology, but you also touched on the fact that the end result is supposed to be a sort of meaningful digital transformation. And on that note, I'd like to turn to you, Slava, because the theme of this year's meeting is resilience, and obviously cyber plays a big role in the modern age for governments and also citizens. And Ukraine is actually a wonderful example of how governments can leverage technology in order to meaningfully improve the delivery of public services for citizens. So I'd like to invite you to give the audience an overview of the Ukraine sort of general strategy when it comes to harnessing digital services, and also some of the practical things that you've worked on both before the outbreak of the war and since.
Yes, I would like to come back in a few words in the past. So the Ministry of Digital Transformation of Ukraine, first of all, it calls like digital transformation. So it's not the digitalization processes on a simple way or something like that. So we come to change Ukraine in the public sector, and some kinds of examples that we have. It's in nowadays times, if you want to book a taxi or take a room at the hotel, you just open the mobile application and do it in a few taps. But if you want to get a public service, often you have a special challenge to come to some specified office in a working hours or something like that. And we our feeling and our strategy is to make a most convenient state, and this is Ukraine for us, and this is our prism for working on the mobile application, first of all, in Ukraine. And as Ivan told before, the working on the digital documents, and really for Ukrainian people, launching the COVID certificate was just 10th document. So we firstly started working on the digital documents on 2019 in December, and for now we have even full legislated passport for Ukrainian citizens, etc. So we have a great path to this situation for now, and for now we have more than 17 millions of unique users of the application, and the great experience that I'm open to share with everyone is it's really the simplest thing that you can do is to launch the digital document, because the most difficult thing is to people to use it. So, and for this, we should to reinvent the technology of the idea of a copy of a passport. So, for example, in Ukraine, we had a lot of discussions when we launched the passport about the copies of a passport, because any public services or any opening the banking account means that you should make a copy of a passport and sign on it that this copy is truthful, or etc. And we had a lot of discussion about screenshots or something like that. And then we understood that trying to use the experience of paper documents in a digital documents is the wrong way. It's like to try to find where I put fuel into Tesla. And this way, we understood that we could create another kind. And for example, for Ukrainian people, when you come to the bank, and the banking manager could scan the QR code of your passport or input in his field 13-digit number of request, and you just will receive a notification that's specified bank requests you for a copy of a passport, and you can just share this into his system. So, and it's all without printing anything or something like that. So it's the most difficult challenge that's even implementation of digital documents, and that experience that we have for now. And we're really open to share this, and I hope while Czech Republic will be leading in the European Union, we will really be in a close connect on all the questions, because all our communications before the war that we have in Euro Commission or in another organizations were about that steps that we've already done while we were exploring the idea of digital documents or etc. and security, of course. So we are really open for that, and I really expect the great common work for Ukraine, for Czech Republic, and for European Union in general.
Thank you for that, and some very interesting sort of on-the-ground observations on the issue of e-wallets and e-IDs, which, as you mentioned, is part of the agenda for you. I've had an interesting question come in on Slido for you, Minister Bartoš, which is the conference on the future of Europe spearheaded new digital tools for citizen participation and deliberative democracy. Is the support of their further development at the EU level part of the aims of the Czech Council presidency? And if so, or if not, can you talk to us about your general views about how to advance citizen participation through digital tools, either at the national level or at the EU level? I'm sure you have interesting thoughts on that.
I think it's more of a psychological question rather than the technology question, because, and not many people know that, right? You can actually put a remarks to European legislation when it's in place, right? You can give your opinion on the European level as a EU citizen to any legislation that's in Europe. Even the conference on the future of Europe was open to participants, and in some specific cases, if you can make that hype, you actually received a lot of notes and comments to the specific legislation, then you need to process them. So I don't really feel there is a barrier of participation, but there is a problem of little marketing on the side of individual states, and that was a question how to get users into new systems, right? If you need it, you usually use it. So we've got 4 million downloads of application showing, storing, and controlling the COVID certificate. But it gives you that opportunity, you know, and a chance to travel, adjust it to the national needs. So there is always a need of something, and then we somehow, you know, trying to put legislation in place. So I believe, and I mentioned that also with the relation to the business, right? That the more open we communicate and get involved all the players and citizen, voter, customer is the most important player in that field, right? The more it would be affected by the opinions that are coming to the system. On the national level and the municipality level, right? You got the tools to get the direct feedback, but maybe people have got little experience that feedback doesn't matter to those who are actually in charge of execute that particular thing. But I believe that will change. It's because when I started Pirates 13 years ago, right? We were somehow felt like, okay, internet is on one side abused by non-democratic governments, and on the other side violated by big IT players on the field. There is no privacy. There is the person in the middle. It's just the data to be sold, right, on the market. But when I look in the European approach these days, even though, you know, it's little of our influence, but the general expertise of politicians and young people coming to deal with politics raise it to the level that Ms. von der Leyen, Ms. Vestager, right, they explicitly said customer and user is the center of everything. His data, his ownership, he gives permission to the government with trust and to the business with trust as well to use the data for particular purposes. And if you ask if we plan, there was a governmental application, which would be one of our goals on a national level. But the simple way we made it and the way we leave people to have that instant feedback, which matters, the people would get more involved. And there is never enough marketing of what could be achieved. And one of them thing that's very strongly related to current Ukrainian crisis and the Russian war on Ukraine, it's a race of disinfo scene. And the role in any time, during the COVID, during the war, before COVID crisis, is to lower the trust to the national institutions and the government, right? So that's one thing we have to work on, not only fighting disinformation, but also, you know, act properly, openly to regain the trust. If you take a look on the north, Finland, Denmark, there is high level of the trust in the governmental offices, in the security of the data. So it's a high level speed digitalization, having BIM in architecture modeling, you know, having almost real-time calculating your taxes if you need it, and you need it because situation changes pretty fast and you as a government has to react. So building the trust and market the services so people are not scared of them and not scared of their data being misused by individuals of stolen identity or whoever gonna, you know, get the data, hackers and stuff. So that's another thing we have to do. So it's not of the technology. You probably have a path to leave your note, opinion on anything. So then, you know, you just have to trust the people that they doing it on the right purpose with good ideas behind. So that's a big goal. And that's probably the part of the security as well, regaining the trust.
Those are very interesting observations, and I'm sure you got comments on this, Slava.
Yes, I have few comments. First of all, about security, I would like to say so. For example, as you know, usually governments think that they know better what the citizens want or something like that. So we have another kind, and we are product-focused and citizen-focused people. And in the development of this mobile application with the public services, we work as a digital company. So, for example, last year we had a bug bounty program. It's a worldwide known experience when the specialist in the cybersecurity tries to leak data from your application, and this is the experience used by Meta or Google or something like that. So any big companies who store some data, even our D application, we don't store the passports from the user. We just like data in transition technology our backend is built on. And so for half of a year, all the cybersecurity specialists from all the world, excluding Russia and Iran, could get the copy of a DM mobile application, and they tried to find a way to leak data from this was impossible. So we had a prize fund from USAID or something like this. So this is like experience that we had like a business, not like a governmental application. Another thing that I reminded for believing in democracy is, so for example, this February, just before the war, we have launched the new experience for Ukrainian people in our application, just voting. So all the world has petitions, for example, yes, when somebody can set up the petition and people will support and the government will review this and make the answer. But there is no possibilities for authorities to ask people for something. So it's like just could be the referendum or something like that, and we just have the voting in the mobile application that's looks like Instagram when you have the vertical video when somebody, so for example, we had the votings from the president or from the Minister of Internal Affairs, and they just in live they ask people about something. We have, of course, the text version of this, and just you can vote. And you know, the recent voting that we had, it was just for 7 days, and we've reached 1,700,000 of votes. So 1.7 million of users vote in a week on the authorities' question. So this is a great experience of democracy, really, because this is the really a great number of people, and this is really no cost for government. So you don't have to print to educate some people or something like that, to make some day for voting on any question. So just simple solution from business, really, that could be realized by the governmental service for now. So this is the experience that we have, and all the services that we've launched is helps us to get more trust from the people, and of course. To reach more and more audience, because when you launch some services that it's simple to be used and it's really useful, maybe day by day or something like that, this is just helps us to grow the audience, because really I think we have also about the COVID certificates, we have most COVID certificates in the same application. So, and when we launched the COVID certificates after European Union, our growing of the audience wasn't very huge, because people already used the application. So this was just a new feature for them.
Maybe I've got a point, right? If we would have, and that's a plan, have the governmental application up and running, which we do have a mobile adjusted governmental portal, but it's not an app, right? And we would put the COVID certificate generator in there, you know, that would be like a good business case of how to promote it, because people were using that app on everyday basis,
Yes.
going to the restaurant and stuff. But we created, the previous guy created that application, so that a single purpose, it's got some features in there, right? And it was got downloaded, about 4 million people actually actively use that. I would feel bad if we switch that application to be baseline for the future government application, but you need to give people reason to use it, right?
Yes.
So if you focused, and there is one difference between the government and between the business, right? If you don't like the bank that you're in because of a stupid internet banking or the fees, you just switch the bank, right? There is not many options to switch the government if you don't like its services. So it's an opportunity. It's actually a challenge, right? So you've got to make it easy and give the people reason to use it. That means I need to solve an issue, and I've got a tool here, so I will use it. You know, so it has to go hand in hand with that what is requested and expected by people from its government to solve their everyday situation. So I believe we can learn a lot, and part of our presidency, and I feel like it very strongly. It's not that we do have a EU, but we've got partners, we've got Ukraine, you know, and maybe future path to EU, which accelerates. But we've got Israeli, we've got Britain, even they are out of EU. So we want to get everybody involved, and all the countries want to get everybody from, let's say, democratic world to be involved in the transformation that's needed. So it's like EU is somehow, you know, making an independent island not to communicate to US. And especially with current situation worldwide, that partnership with America after the Trump administration, with Biden's administration, should be flourished, and we could benefit for that mutual cooperation. And adjust somehow even our European and other country regulations in order to fit. But still, we are Europe. We care about the data. So, and that's what we built on, right? It's not like the Eastern China, all data to government. And we are pretty sure we don't want to give all data to like the major players on the business field. And with that respect, you know, we just need to find a common border of this is how we understand it's a limit of security, privacy, which is the strongest thing that I believe in, and then the acceleration of innovation. And we'll be happy to share. And that's what it's actually based on, all the EID approach that we took. There are already like 30 billion euros to use for the pilot projects. So Poland's developing, they even got this pet vaccination certificate, which a lot of people got dogs and travel with them pets, right? But the thing is, I go somewhere abroad and I need to carry my university diploma, which is a pergamon paper with Latin signs, you know, and somebody review if it's like original. No way. I wanna have blockchain app that gives us to the e-wallet that, you know, I've got this kind of education, this is my working history, and if I get hurt anywhere, and it doesn't have to be European Union, I would just like give a permission to actually share my medical data.
Yes.
And
So
that's what we need in the future.
What's really fascinating, and I wish we had more time for this discussion today, is that we're, you know, in a time now where we're not just talking about big ideas, we're actually building things, and it's about sharing best practices, but also collaborating. And I just wanted to get a sense from you both, bearing in mind that we are running out of time, so please keep it high level, but how you view the role of international cooperation between allies, not just within the EU, but, you know, for instance, between the US and the EU, or you also mentioned Britain. There's talk of digital sovereignty and digital autonomy. How do we ensure that we maintain a sort of cohesive approach as these digital tools are being built out? Maybe if you could both just offer sort of high-level thoughts on how to foster digital cooperation as you pursue these goals. Slava.
I would like shortly to say that war some way has its role. Because, for example, on our side, yes, a lot of Ukrainian people moved to European Union and non-European countries. And just since that we had some communications before, people on that side, border guards on the side, had the information about the digital documents, because a lot of Ukrainians moved without passports or without something that would help them. And after that, we started having a lot of communications with different countries, including even Australia and Canada, about how it's possible to work with digital documents for Ukrainian people. And for me, it's not just the implementation of this. This is the great example for that countries of the request of society. So society might be ready for using such technologies, and just after that, the government could understand that people are open and they can start some dialogue with this and to share their experience, because I'm sure, and I'm sure that you'll be sure agree with me, that digital documents, for example, is the question of time, and the only one kind of digital technology for passports or another documents, it's a question of time, and it's just our aim might be the world, all the world, just this way should be maybe more quick or something like that. But this is just a question of time, and really we should cooperate between each other to not to reinvent the bicycles, yes, just to get the better experience and get the better solutions.
Thank you. We've got about 90 seconds left. Minister Bartoš.
Mutual trust, open debate, so nobody would get surprised by the result of debate. Platforms to actually have the debate on, which GLOBSEC is one of them for sure. And what I believe is just we have to agree on certain standards. That means somebody would accelerate and someone need to slow down a little bit in order to meet in a place, in a time. And I believe this is like the common ground that we want to achieve. So we could interoperate, we can flourish from each other invention. And the trust is the most important thing, because we should be partners. And that's it.
Can we expect developments in the Transatlantic Trade and Technology Council during the Czech presidency as well on standards?
We hosted 9+ in Czech Republic, where the business was involved as well in that morning session. Then we did politics on the political level, and we are expecting result of TTC because of all the data flows that are going across the ocean. We had an issue with the safe harbor, right? So the trust has to be again where it's not, and we are expecting certain level of open source or openness, even with algorithms, maybe with the targets, what we would like to achieve. So if nothing is hidden, we can find, you know, the balanced way to develop, to be more resilient and to cooperate.
Lovely. Final words, Slava, before we wrap up.
Thank you very much for supporting Ukraine. Don't stop following the news, because the war is going on every day and it's not seems like to be very short. So thank you for support and support us more.
Fantastic. Thank you. And please thank the panel for a wonderful discussion.